Thank you very much, Misha. Thank you, Pamela, and greetings to all that are connected onto this webinar. And we are glad that you have joined us as we can commemorate the 2018 World No Tobacco Day. And I think for us at the African Heart Network, it's a very, very fitting commemoration in that we are taking our time to talk about tobacco and the heart, in that tobacco breaks the heart. And the World Heart Federation, I think, has done well to invite us to this platform. So probably I start by saying a few things about the World Heart Federation. Misha, could I have the first slide, please? So the World Heart Federation is an organization that is dedicated to leading the global fight against cardiovascular disease, including heart disease and stroke. They say that they are the only global advocacy and leadership organization which brings together the entire CVD community to drive the CVD agenda and help people live longer, better, and more heart-healthy lives. Indeed, we are proud to be members of the World Heart Federation, and us and the more than 200 other organizations which are members of World Heart Federation and patient associations in over 100 countries believe in a world where heart health for everyone is a fundamental human right and a crucial element of global health justice, because every heartbeat matters. Now, if we get down to World No Tobacco Day 2018, and I would want to just highlight the issue of tobacco and heart disease. Well, I'm sure we are all aware of tobacco, that it is one of our main enemies when it comes to heart health. Tobacco is said to kill over 7 million people every year. Smoking is said to be the second leading cause of cardiovascular disease, but the #1 preventable risk factor for cardiovascular disease. I think that is why it's priority for us to now address tobacco and tobacco use. It is said that tobacco directly is responsible for 1 in 10 cardiovascular deaths. And that alone accounts to about 1.7 million deaths every year. What is worse is really not only that tobacco kills the active smokers, but it's really the amount of damage it causes to non-smokers, those who are within the environment where tobacco smoke is circulating. People who are exposed to secondhand smoke, or passive smokers, we call them. It is said that tobacco causes more than 360,000 deaths from cardiovascular disease every year. More than 63% of all premature deaths really being attributable to secondhand smoke, exposure. And I think what is worrisome to us as well is that, tobacco does not kill in a dose-related manner. It's not only the heavy smokers who are killed by tobacco. Even one who is exposed to just 1 cigarette a day has almost 50% risk compared to one who is a heavy smoker. And what is good news is that when one quits smoking, he gets all the privileges that come with not being exposed to tobacco smoke at all. It is said that 1 year after quitting smoking, the risk of coronary artery disease halves. And after 15 years, it disappears completely, meaning that quitting tobacco use is an emergency and is something that we must encourage starting on 2018 World No Tobacco Day. Next slide. While as tobacco directly causes a lot of death, we must say that it also contributes to a lot of other heart diseases or heart issues. It is said to contribute not only to ischemic heart disease or coronary artery disease, but it is also a contributor to stroke or to cerebrovascular disease, as we may call it in other circles. But it also contributes to deaths through chronic obstructive pulmonary disease. It contributes to deaths by lower respiratory tract infections. It contributes to the occurrence of tracheal, bronchial, and lung cancer. And tobacco does contribute to the causation and exacerbation of diabetes mellitus, sugar disease, and also tuberculosis, which to us in the third world, I think is still a reigning menace. And so all these diseases put together, tobacco is actually a very big risk factor to heart health. And I think we need to take time in 2018 to talk about that. Next slide. How does tobacco really cause cardiovascular disease? How does it injure the heart? Well, it injures the heart directly and indirectly, as we have already said. But directly, tobacco, there's some.
Go ahead, Caston.
Oh, sorry, there was some background noise coming my way. Yeah, okay, thank you very much. So tobacco actually does cause damage to the heart directly and indirectly, as I said. Directly, tobacco damages blood vessels. It makes the blood to be thicker, and so it's more predisposed to clotting, meaning that within the heart, it actually would cause heart attacks. In the other systems, especially in the brain, it may lead to stroke. But apart from it injuring the heart directly, nicotine, which is the substance in tobacco that causes the addiction, also has its own influence on the cardiovascular system. It mostly causes the heart rate to increase and also blood pressure to increase. And these surges in blood pressure and the surges in heart rate actually predispose the blood vessels to injury, further increasing the risk for heart attack and stroke. Tobacco also is said to deprive the heart of the very much needed oxygen, as it supplies the system with carbon monoxide instead, and so depriving the heart of the needed nourishment. And so the heart would definitely be damaged, and we must do all that we can to protect the heart against these effects. Next slide, please. Apart from its direct involvement in injuring the heart, tobacco causes injury to the systems that are directly related to the heart. That's mostly the vascular system. But I must start by talking about its influences on TB, which can affect the heart. TB pericarditis, we know, has disappeared in most countries, but in the low and middle income countries, we are still battling with TB pericarditis. This is the infection around the heart caused by TB, and most of this can be predisposed to by tobacco use. But tobacco also causes injury to blood vessels, and it may lead to amputations. And in the men, we say it does cause erectile dysfunction, and that may lead to male infertility. But it would also cause injury to kidneys. Kidney damage would either cause kidney failure, or indirectly to cause blood pressure to increase as well. That's injuring the heart further. But it may also cause blindness because blood vessels in the retina get damaged. Next. I really think that what we must be addressing is why tobacco continues to cause so much damage in the people who are exposed to it. I think mostly it's the issue of ignorance. And I think this is very true for the third world. There's a lot of ignorance about how tobacco hurts the heart, how tobacco breaks the heart. And there are a lot of misconceptions, I think, that we must address during this time. Many communities are making us believe that tobacco is a very low risk factor for lung cancer. While as tobacco may be a risk factor for lung cancer, it is not a risk factor for cardiovascular disease. That, I think, is false. We must say that, tobacco causes more than 60 known serious diseases, among which are cardiovascular diseases. And so it's a very, very serious factor, risk factor for cardiovascular disease. I've already said about the dose. Many people say if you smoke only 1 or 2 cigarettes a day, that's safe for you. But as I said, just 1 cigarette predisposes you to as much harm as a heavy smoker. And so I think we must be advocating for zero smoke and zero exposure to tobacco smoke. And there's also a misconception that smokeless tobacco is a safer option, especially for heart disease. And this is, I think, what we found when we did our survey in Zambia. Many Zambian users of smokeless tobacco thought that they were better than those who were smoking tobacco. But no, we must say that the injury to the heart caused by smokeless tobacco is no better than that caused by smoked tobacco. And now there's also a movement towards using e-cigarettes. We are saying that e-cigarettes are healthy, a healthier substitute to tobacco use. But I already said what nicotine actually does to the cardiovascular system. And e-cigarettes deliver nicotine. And nicotine can be as harmful as anything else to the cardiovascular system. And so I don't think e-cigarettes are an option when it comes to heart health. And then there's also a misconception as to how tobacco affects men and women, okay? Some think that men are at more risk than women, but no, we must say that they are all equally at risk, and we are more concerned with tobacco use in the women because there are more systems which are damaged by tobacco in them than they may be in men. And so I think we must fight this tobacco from a platform of knowledge. And we have to say tobacco is harmful to hearts of both men and women. And there's also a misconception that people who use tobacco don't want to quit tobacco. And again, that is a very, very false misconception. Many people who smoke or many people who use tobacco actually regret ever having started smoking or ever having started using tobacco. They want to stop using tobacco, and they want to stop using tobacco yesterday. And so it's really, the onus is on us to help them to quit. And I've already talked about secondhand smoke and how it injures the heart. More so, please, we have to protect women, especially pregnant women, because it causes not only miscarriages, but it may cause stillbirths, and that once children born may actually die very, very quickly or very easily. And then there's a misconception, especially in the third world, that light cigarettes are less harmful, or those cigarettes which are labeled low tar or low nicotine. We think that they are less harmful than regular cigarettes. Again, this is a myth, mostly perpetuated by tobacco companies. Any tobacco smoke is harmful to health and must be kept away. Next slide, please. I just wanted to show you a slide as to how much ignorance there is or continues to prevail, especially in countries in the middle and low income. On this slide, we have results from the International Tobacco Policy Evaluation Control Project, the ITC project. And here, out of 14 countries, we are seeing 2 African countries really featuring among the 3 countries that have lowest knowledge of tobacco smoke. We have Zambia here and Kenya showing that men who smoke tobacco have very low awareness of the harms of tobacco use. Next slide, please. And this is the slide I was alluding to, that the issue of smokeless tobacco is an issue I think that we need to address more, especially among our women folk. In Zambia, we have more women using smokeless tobacco than men, and they think that it's safer than smoked tobacco. But I think this information we are trying to get out this time is to say smokeless tobacco is as harmful as smoked tobacco. So all tobacco is harmful, especially for the heart. And I think we need to be urgent in getting our messages out to our people. Next slide, please. I will now hand over to Pamela to try and get us through our responsibilities as healthcare professionals in how we can help protect the heart against the harms of tobacco. Over to you, Pamela.
Thank you so much, Fastone. Thank you for that wonderful background to the presentations today. I think that is really important, this section, looking at the role of healthcare professionals, because many of us are not just frontline healthcare workers, but we're also researching and writing about the harmful effects of tobacco smoke and tobacco smoking on health in general, and also specifically heart health and brain health, if you like. So what is it that we can do? You know, are we so inundated with our work that we can't become advocates? Well, I want to try and convince you in this presentation that actually it is, it's not really that difficult to become an advocate for the anti-smoking lobby groups. So I do believe it's the responsibility of all in the health sector to make a concerted effort to get involved in tobacco control, given its negative direct and indirect effects. So it's beyond the scope of this presentation, but I mean, some of the indirect effects, for example, would be the costs associated with tobacco smoking at a familial level, but also at a societal level and globally. Now, we must recognize that tobacco smoking is not just a nicotine addiction, but a social problem, because we see that it has a very strong behavioral component. So young people tend to mimic the behaviors of people that they consider to be their role models. And unfortunately, oftentimes, you know, it's not always a good role model. But the other angle of the social problem is, of course, the social and economic one. So therefore, we have to take a multi-layered approach for tobacco control. So we've got to see that the role of healthcare professionals extends beyond a medical one. I think, you know, traditionally speaking, we've always kind of, healthcare professionals are stuck either in a clinic or in their medical practice in a hospital, and perhaps they're overworked too, but, you know, so they don't sort of feel that they can do beyond just the clinical service. But we do have to make an effort from an individual level, tobacco cessation, lobbying for increased family and community interventions, which we need to locate in a public health framework to make it effective so that we can have that behavior change at a population level and get less people to smoke tobacco, if not all, at some point in the future. Next slide, please. Right, so if we look at the role of the healthcare professional, we don't always have the time to engage at a, you know, at a very strong level in advocacy, but we can choose which strategies we can put our energies into. And so let us look at some of the health promotion methods that we could possibly consider. Now, health promotion is key to reducing the increasing burden of chronic diseases worldwide due to tobacco smoking, and Fasto and Goma very nicely told us what some of those disease conditions are. Besides just heart disease and stroke, there are a whole variety of other diseases as well. So health professionals, therefore, need to increase their knowledge about smoking cessation methods in order to support and encourage the large number of individuals who want to quit. So they people who want to quit, we really should be encouraged and not stigmatized. So there are various approaches within health promotion. that have been utilized for smoking prevention and cessation, but health promotion can focus on the following. You might be kind of a frontline healthcare worker, so the physician counseling might be an easier way to do this. And a specific approach that's been quite effectively used globally is the motivational interviewing approach, which is usually a one-on-one. Then, of course, you have, to be a bit more cost efficient, you could go more to a group setting, and you could have perhaps peer education groups. Then, of course, if you're able to put in a lot more money into advocacy, we could look at social marketing, media advocacy, and mass media campaigns as one prong of the strategy to reduce harm from tobacco smoking. I think community mobilization is quite a critical one. And I think that in ways that we possibly don't often think about, we can actually do. If you look at the social capital in any community, we are able to empower and to socially mobilize people through various other organizations that exist in the community, such as faith-based ones, youth organizations, sports groups, and so on. I think that a settings-based approach is really important, because if you actually look at, we are actually obliged based on the Ottawa Charter's assertion that health is created and lived by people within settings of their everyday life, where they learn, work, play, and love. So in some ways, I think we're going to talk a little bit more about this later, but we really do have to locate the harm reduction approaches that we're trying to implement within a more, a human rights framework. Next slide, please. So if you look at, unfortunately, this is a little gender bias, but people email us through the World Heart Federation platforms, we can provide more data on, and not make a gender bias. But we just thought, to make it interesting, we provide just one slide in the interest of time to look at male smokers offered cessation advice from doctors or other healthcare providers in low, middle, and high income countries. And it's interesting that it seems that the biggest drive is coming from the middle income countries, from healthcare practitioners. If you look at Brazil, for example, I mean, you've got a 96% cessation advice given. But, I guess that one has to question the uptake, but at least the healthcare practitioner makes that effort. If you look at high-income countries, I mean, it's sort of hovering around 68 to 69%, countries between Australia and the United Kingdom, and then it goes down to as low as the Netherlands at 15%. And then, of course, in the low-income countries, Bangladesh seems to be making a bit more of a drive, the healthcare workers. And I think Kenya, perhaps we still need a little bit more work there. So many countries around the world need to perhaps educate even the healthcare practitioners about the importance of their role as frontline healthcare workers. Next slide, please. So it's not all gloom and doom. I think that is kind of one of the key messages we'd like to convey today. Yes, it is really, the epidemiological pattern of tobacco smoking is very worrying. The effects of it on heart health and brain health is extremely worrying. But there are solutions which, if I think we all speak with one voice, if all countries are able to follow a global framework for tobacco control, we'll do possibly a lot better. So some of the solutions include the World Health Organization framework on Convention on Tobacco Control, so the FCTC as we commonly know it, the Global Hearts Initiative, and then Empower, and I'll just quickly tell you what Empower stands for, so that you're able to kind of identify with it and possibly even try and mobilize your countries in the meantime. So it's M for monitor, P for protect, O for offer help to quit smoking, W for warn about the dangers of tobacco, enforce for E, enforce bans on tobacco advertising, promotion, and sponsorship, and R for raise taxes on tobacco. This clearly tells you that actually it has to be a multi-pronged approach to make the harm reduction successful. Next slide, please. Right, so I think that one of the other messages we want to give to you today as healthcare professionals, advocates, and anybody else of interest that's listening in, is that everyone can actually be an advocate against tobacco. Governments and policymakers, we should advocate for tobacco control policies and smoke-free laws, implement health warnings on tobacco products and labels, warning about CVD risk, support policies for the provision of smoking cessation advice and pharmacotherapy, promote the use of mass media campaigns to raise awareness about cardiovascular disease risk posed by tobacco use. And I think perhaps for interest, our listeners should go to the various countries to see what successes and how far they've progressed on tobacco control policies and smoke-free regulations. South Africa, for example, as a case in point, has progressed quite well. Our minister has just put out a new bill, which will also include electronic cigarettes. So we're kind of doing relatively well, and we still have a long way to go still, though. Where healthcare professionals are concerned, let's avoid smoking ourselves. So we should be a good role model to our patients and people around us. We should advise patients on quitting. We should implement smoke-free policies in health facilities, universities, and so on. And let's be advocates for tobacco-free investments, implement programs against secondhand smoke exposure, support the inclusion of tobacco cessation counseling in medical curricula. It's always interesting for me when you go into a hospital setting, you do see patients smoking outside the hospital. And I'm really hoping that that also comes to an end pretty soon. And then finally, commercial establishments should definitely comply with smoke-free legislation and keep establishments smoke-free. And let's avoid advertising or promoting tobacco products and making it too attractive for young people in particular. Next slide, please. Right, so if I could just quickly tell everybody about the World Health Organization, World Heart Federation joint collaboration for World No Tobacco Day, which is on the 31st of May this year. So we're 2 days away from it. So please do go on the website and you'll see there's the development of joint materials between WHO and WHF. There's printed web and social media collateral in all the various World Health Organization languages. Then we have the video being displayed in several settings, including the Geneva Public Transport System. We have the joint brochure on tobacco and cardiovascular health. We have fact sheets for general public and health practitioners. We obviously have the press releases, which are joint between WHF and WHO, World Heart Federation, and the Framework Convention Alliance by World Heart Federation towards World Heart Day. Because remember, our theme is tobacco breaks heart. So we're really mobilizing towards World Heart Day. And then we got exciting case studies featuring heart heroes, where there's professionals who have actively contributed to tobacco cessation in their communities. So please do lay your hands on all these exciting materials. And then also look out for the planned events in the week of World No Tobacco Day, which is this week. And the event at the World Health Organization headquarters on the 31st of May. All right, so I thank you for that. I am imagining, Misha, that are we going to do questions and comments before you present your section?
Yes, that's right. So what we foresaw is that people are given the chance to ask questions or comment on this blog at this point now.
Sure.
So before everybody comes in, you may unmute yourself, of course, and ask your questions. Maybe I should point you to the chat box. So we already had a couple of questions regarding the source of the data we've been using, and one particular one which I'm just going to read out as to what percentage does tobacco exposure risk the exposed to heart, stroke, and cancers in Uganda was one very specific question. I don't know whether you have the precise answer to that, but these are two questions we already have in the chat box.
Well, I think that's a bit specific for Uganda. And so it may be well for our colleague to try and ask our colleagues in Uganda to give the specifics. But I think there is a slide which shows the proportion of contribution of tobacco to stroke, especially on our slide. And so you can have a look at that one. We did not really talk much about cancers because this year we have concentrated on the heart mostly, and so we are really talking heart health. But yes, tobacco is a very huge risk factor for cancer, and I think it's something that must be taken care of even in Uganda. Thank you very much, Misha.
Misha, if I may quickly add, I think that, you know, generally speaking, tobacco smoking triples the risk for a heart disease and doubles the risk for stroke. So, you know, despite whatever the epidemiological pattern in a particular country is, that is kind of the bottom line. So I think, you know, that's important to remember. Thanks, Misha.
Okay, thank you very much. And this is now the opportunity for colleagues to unmute yourselves and ask a question or add your comment should you have one.
Hello, this is Kellen.
Hi, Karen.
Hi, I'm very grateful to the team at FCA and World Heart Federation for sharing with us this interesting information, and I believe it will strengthen us as we go for the 31st of May to commemorate the World No Tobacco Day. I just had two comments on to add on. One is one of the challenges that we should be cognizant of is the tobacco industry. And as we plan ahead and move forward with tobacco control, and certainly agree with all the solutions that were given, we need to be cognizant of industry interference and how it also actually interferes with tobacco control policy implementation, especially in low middle income countries, which has been extremely aggressive. So as we go out there to talk about cardiovascular health and tobacco control, we need to also be cognizant that we have another vector that moves all the time with us and that we need to be very alert. The second thing that actually interested me a lot is to find out that in a country like Kenya, there is low knowledge on smokeless tobacco, yet in Africa, that's one of our best implementing countries for tobacco control. So it tells us, I think, that every day we learn, but also that it's important for us to even look out for the tiny things that we would probably ignore, but that are important. So I'm pointing to the fact that we, in Africa, much as we need a lot of knowledge on tobacco control in the communities out there, we need to emphasize the campaigns. I don't think there's been a very strong campaigns on tobacco control as we had, or we've seen in areas like reproductive health, the HIV world, where Africa took on and a campaign, It Starts With You. So we need to look at a regional approach to some of these big issues, especially campaigns. They are very expensive, but we know that we need them. Africa for sure needs a lot of sensitization, because even when you break it down, move away from smokeless tobacco, but to linking cardiovascular health with tobacco, that even is much lower in Africa. So people don't know. They don't even understand that when they sit in a public place that has tobacco smoke, that they are actually facing danger or trouble. So the campaigns are important, and we need to think about a regional strategy. Thank you.
Thank you very much, Kellen. I think, Misha, that was an excellent contribution from Kellen. And I don't think we need to say much. I think she has said it all. But really to emphasize the point of domestication of these messages, that we need to be local. In every campaign we take, we must address problems that are local. And the tobacco industry is very notorious in deviating our attention, you know. And so, yes, for Africa, I think we have a lot more issues to attend to. And it's good, it's actually prudent that we take this opportunity to address African problems using the African zeal. But we must move to protect African hearts against the harms of tobacco. Thank you very much, Kellen.
If I can quickly add, Misha, that just to remind Kellen that we have the African Heart Network, please, she must reach out to us as well. And we all work obviously we're part of the World Heart Federation. So regionally, we can also try and drive the message in Africa. Thanks.
Yeah, thank you both. And thank you, Kellen. There's another question from Moses.
Hello?
Hi.
Yes, I was thinking it's important for us to consider mobilizing state resources, especially in trying to call for reform. The law enforcers, the health sector would need funding. And you know, for most of the countries in Africa, we don't have as much funding, especially to support people who want to quit. I associate myself with the statement where the facilitator said that if we can continue giving out the message of if people quitted, then there are higher chances of them even not succumbing to all these diseases. For that, I agree. But I think also it is important, considering now that we are in the budget processes, and most of the ministries of finance have proposed what they need to expand in the tax bases. So I think it's important for us to advocate for higher taxes on cigarettes and related regulated tobacco products. Thank you.
Yes. Thank you so much, Moses. I think that's an excellent comment. I think that what we found is South Africa as a case study, as an example, we really are, you know, it's political will as well. So our ministers are very driven to, you know, for these risks to be mitigated. So I really think that it's important for advocates to put pressure on government as well, in a good way.
But also just to say that, you know, this is where we get back to Kellen's point about, you know, the tobacco industry. Mm-hmm. Because the tobacco industry won't allow governments to increase taxes. And this is, I think, the biggest hurdle we are finding in places such as Zambia, where the tobacco industry is still promoting production of tobacco and insisting that their contribution to the national pot in terms of taxes is much better without taxes. And so I think we have a big battle to fight there, but we must do it. I think he's very right. The time to start is now. As the budget cycle starts, let's talk about tobacco taxes and to talk about them really as a source of funding for this for the tobacco control activities. Thank you very much.
Thank you both. Do we have another question still? We have comment on the chat box actually, which I'm just gonna read out, which is from Makasa from Zambia, very insightful presentation and discussions under solutions and the need to involve all, including academia. Are there platforms that could support local academic institutions in all level of research is the question.
Misha, sorry, I think my connectivity was a bit poor there, so I missed a part of the question. My apology.
I'm going to read it out again, yeah? So under solutions
right.
and the need to involve all, including academia, are there platforms that could support local academic institutions in all level research?
Yes, I can speak for South Africa, and Faston can perhaps, speak on behalf of some of the countries he knows in Africa as well. But we have tried to have a multi-stakeholder engagement, and academia and the researchers are very much a part of it. In fact, back here in South Africa, the Minister of Health takes a lot of direction from our primary research institutions like the Medical Research Council and the Human Sciences Research Council and the CSIR and so on. And a lot of academic appointments are joint with these research councils. So there is certainly an interlinking of evidence-based policy making for health in South Africa. So Fastona, you want to share maybe Zambia's example?
Yeah, thank you very much. But I think the comment from Makasa is very appropriate in that, academia needs to generate knowledge upon which policy and practice is based. And I think there's been an amount of research going on in Africa now, and we have quite some good databases from which we can get information. I'm sure we saw some slides from the International Tobacco Control Evaluation Project, the ITC project. We have 4 African countries now which are participating in this very robust research among, I think it's now 23 countries in the world. And this is a very, very rich database which gives us an information for the policymakers. And then we have step surveys going on as well, which are providing us a good databases as well in many countries. I think what we need to work on is how we translate knowledge into action. And I really want to thank Makasa for that comment. We need to have evidence-based practices when it comes to policy and practice, especially when as we address tobacco control now. But there is good amount of information coming from Africa now, and I really think that that is commendable.
Thank you very much. We're getting now also more comments in the chat, people requesting the presentation. So we are currently recording the webinar. We'll make it available through the channels of the World Heart Federation. And also, if you allow me the little bit of advertisement, the FCA will actually launch today a new website. So we'll also make it available on our brand new website. So invite you all to check it out and look at the presentation, but also look at our new website. One last comment that is in the chat right now. Also, Amit was requesting any more research papers, evidence on smokeless tobacco and the connection to CVDs. So anything on that, we would also, of course, be willing to share and make available. I don't know, Fastona, whether you want to comment on the smokeless tobacco one more time.
Yeah, thanks. I think we are still accumulating information on smokeless tobacco. And that is because, as I said, it has been ignored in a lot of researches going on. I think most of the questions have been on tobacco smoking. And so the information on smokeless tobacco is still little, but I think it's coming up. And what is more interesting is, I think the use for smokeless tobacco, it keeps changing, especially in the African community. There was snuff, there's chewed tobacco, then there's tobacco which is just put under the tongue. But now we hear that some women are using tobacco also as an aphrodisiac, putting it intravaginally. And so these are really uses that have not been traditional. And so I think the researchers have really not gone into asking those questions. But I really think that we need to circulate more and more of this information. So as you've promised, I think we'll try and get information for that we can circulate through the World Heart Federation. And WHO, I think, is also doing its best to try and get this information on the different websites. And so I think let's keep our eyes on the platforms and share the information as it comes. Thanks, Misha.
Thank you very much. And thank you very much, Pamela, as well. I guess with an eye on the time, we should probably looking into moving on to the second block of the presentations, unless somebody has a very urgent question. But that does not seem the case. And yeah, then let me thank the presenters one more time. We'll be moving into our second agenda item, where I will just quickly speak about the FCA, what is the FCA and what is the FCTC, for the people that had not had the benefit of learning a lot about it. And after that, my colleague Ryan Forrest is gonna give you some up-to-date information on global strategy for tobacco control that is currently being worked on. So the history of the FCA and the FCTC in a nutshell. The FCA, the Framework Convention Aligned, was actually created in the 1990s with an intention of bringing together members from civil society that were participating in the internationally negotiations on a global tobacco control agreement that eventually was called the Framework Convention on Tobacco Control and has been in place for over 15 years now. As a consequence of that, FCA gave NGOs voice and a possibility to participate in these negotiations, and now is a platform for almost 500 NGOs from over 100 countries and with staff represented in all WHO regions in the world. Our vision, of course, is to create a world free from the devastating health, social, economic, and environmental consequences of tobacco and tobacco use. And our mission is to strengthen the Framework Convention on Tobacco Control and support its full and accelerated implementation wherever we can. The most recent strategic plan of the FCA is called the 2020 strategy, and it has 4 pillars, which we call build, hold, embed, and deepen. Of course, we intend to build, first of all, pressure, political pressure on countries to quickly and swiftly implement the FCTC and its provisions, because this is what is necessary in order to get the whole fight for tobacco control going on the ground level. But we also need to hold them accountable, and that is the second pillar, because many of you may know the FCTC has over 180 parties, 181 to be precise at this point, but just a commitment to an internationally negotiated document does not make action. So we also want to hold governments accountable to their commitments that they've made internationally and ensure that national action will follow. And we also want to embed the FCTC into national strategies where they exist, because if we can reinforce links between the international treaty and national strategies, will make the network stronger, and this is of course what we intend to do. And we need to deepen FCT integration into international systems, especially with a view to development policies.
Already a couple of times during the previous presentation. So if we can link, for example, FCTC implementation with the field of development financing, this is of course a good opportunity for us and something that we certainly try to pursue.
In this way, the FCA, for example, has achieved that the FCTC has been recognized with a 2025 target of reducing prevalence of tobacco use by 30%, and also that there's a 2030 goal in the Sustainable Development Goals, which is trying to promote healthy lives and the well-being for all ages, saying that premature deaths from NCDs, and which are often caused by tobacco, should be reduced by a third by 2030. Very quickly, as I mentioned, the FCTC now has 181 parties and is approximately covering over 90% of the global population, which is, of course, for an international treaty, a great success. And few international treaties are more successful in that regard. But we also have a few notable countries, 15, that at this point are not parties to the FCTC. Amongst them are the USA, Indonesia, Switzerland, and Argentina, for example. So a few blind spots do remain. What is interesting to point out, of course, is also Article 4.7 of the FCTC, that in particularly states that the participation of civil society is essential in achieving the objectives of the convention and its protocol. And this is exactly what we are trying to do and what we are trying to push. And this is what the FCA is basing itself on, what the FCA is for. So, despite already having an international agreement, the reality in many countries on the ground is not as rosy, unfortunately, as one would think when looking at an agreement that is covering 90% of the globe. Unfortunately, in many cases, domestic legislation is still weak, and the tobacco control movement often is facing capacity challenges. This is because tobacco sometimes is not perceived as a public health priority by politicians, and resources for tobacco control can be scarce. And FCTC is not necessarily recognized as a development priority at national level. Much of this goes back, and Fastona mentioned that, and the question has been raised already during the first set of our discussion. Much of that can be traced back to tobacco industry influence that still wields great political pressure and also economic power in many countries, and can lobby governments to not pursue tobacco control policies that from a health perspective are overdue and dearly needed. So we are basically in a battle right now. If you look at the latest report of the WHO on the global tobacco epidemic, they have looked at the countries, as I've said, over 180 parties right now, and graded them according to the implementation of the FCTC and smoke-free legislation that is in place. And 55 countries were actually considered to having achieved the highest level of implementation. You can see that on the map, which countries are supposed or considers to be leading right now, and the countries where we still have work to do. So progress has been made, but progress is always slow. It's a small process, and we need to keep chipping away. And the map on the screen right now tells you where we still have our work cut out for us. Here are just a few tools that we found, and those are evidence-based tools actually, so they are known to work, they have been proven to work, that we would like to recommend. And few of them have been mentioned already, but certainly tobacco taxes are one of the most important tools for improving tobacco control and encouraging cessation. You can see in the graph on the right-hand side that if a given country was to increase taxes by 10%, you see a direct connection between the smoking rate in adults that goes down between 3 and 7%, but even more important, less young people, between 5 to 15%, are actually taking up smoking, which are under the age, or who are under the age of 18. So this is a very effective tool of breaking the link of young people trying out cigarettes and then quickly becoming addictive and having difficulties kicking the habit during their whole life. Smoke-free legislation is certainly another important part and tool that has proven to work. If public places are smoke-free and smoking becomes denormalized, this encourages other people, or this encourages smokers, of course, to try to quit if their behavior is not encouraged by or tolerated by society on public places anymore. Plain packages, where you can see an example at the bottom of the screen, are also known to have an effect, especially when in combination with the health warning that are shown there. And banning tobacco advertisement promotion sponsorships, where the industry can actually create a favorable image for itself by sponsoring music festivals, by even allowing billboard advertisement or other kinds of promotional activities, even in connection with a respectable political organization. All that, of course, needs to be forbidden. And there's according recommendations in the FCTC. And of course, the big one has been mentioned already a few times. We have to protect the policy process from the vested interests of the tobacco industry. Very important. So I hope this gave everybody a good overview of where we stand regarding the FCT at this point, its implementation, and the work that the FCA is doing. And now I would like to invite my colleague Ryan Forrest to give you some information on global strategy for tobacco control that is currently being negotiated. So Ryan, please.
Thank you, Misha. And hello, everyone. Misha, thanks for providing that background on the FCA for those of us on the webinar, I guess, this morning who are joining from the World Heart Federation community. Misha also outlined some really helpful background and talked about some of the challenges that countries face in implementing the FCTC, including things like a lack of political will, a lack of resources, and tobacco industry interference. But I guess that I'm here to share some good news, which is that there's a plan in the works to deal with these challenges and to enable progress on tobacco control around the world to take place at an accelerated pace. So Misha, if you wouldn't mind just switching to the next slide. Thank you. So this plan, or the idea to develop this plan, came about as part of discussions at the 7th session of the FCTC Conference of the Parties. And for those who don't know, the Conference of the Parties, or the COP as we call it, is comprised of all of the governments of the countries who have signed on to the treaty, and it meets every 2 years to review progress implementing the FCTC and to address the challenges that stand in the way. It's in many ways, I think, the closest thing that we have to a global parliament for tobacco control, since it's really the world's only dedicated intergovernmental body on tobacco control. At COP7, there were a number of discussions that took place about how the COP can better support countries to implement the treaty. This included a number of discussions on things like how to mobilize resources, how to strengthen the mechanisms of assistance that exist under the treaty, and how to put the reporting process to better use. In the end, it was decided to kind of unite all of those disparate discussions into one bigger discussion. And the decision was that what the COP really needs is a medium-term plan to ensure that action on FCTC implementation takes place at an accelerated pace. So I'm going to tell you now a little bit more about this plan. FCA has been working to support its development and will be working to ensure that it's adopted at COP8. So it's one of sort of our major advocacy priorities for the meeting that's coming up this October. Next slide, please. So the strategy has been developed by a working group of 12 parties to the FCTC alongside IGO and NGO stakeholders. And as I mentioned, FCA has also been working to support this as a member of the working group. So we attended both of the meetings of the working group and supported the drafting of this document. The working group also considered input from all parties to the convention through a number of consultations that took place over the course of 2017 and through the early parts of this year as well. As it stands, the strategy identifies a limited number of priority actions, and the choice of which measures to focus on in the document was based on 3 key criteria that the working group decided on. So the strategy identifies as priorities those FCTC measures that, 1, have the highest impact on reducing tobacco use, those that facilitate building capacity for cross-sectoral action, because we know that FCTC implementation requires the action and the cooperation of ministries beyond health, and also those measures that make the greatest contribution to achieving the Sustainable Development Goals. So the idea is that the priorities that have been identified based on these criteria will guide the work of the parties, of the Convention Secretariat, and of observers to the FCTC over the next, I think that the strategy goes to 2025. It also looks beyond just the FCTC and its parties to the larger global community, and also outlines some opportunities for stakeholders like the World Health Organization, for other UN agencies and intergovernmental organizations to support the achievement of the aims of the strategy. And lastly, it includes a number of indicators as well, along with each of the objectives, which will enable measurement of progress and results of this strategy. If I could have the next slide, please. So many may be wondering, how exactly is the strategy going to help to move the ball on FCTC implementation? I think one important thing to highlight is that it will be a really great tool for advocacy at the national level. For one thing, it can help to inform and guide the development of national plans for tobacco control, by identifying the priority measures that are going to have the most impact on reducing tobacco use. It also can help to encourage engagement of sectors beyond health, like ministries of finance. And a key objective actually of the strategy is to facilitate multi-sectoral action on tobacco control. So the document calls for, in particular, action to implement Article 6, which for those who don't know is tobacco taxation. So I guess, just kind of imagine being able to go to your Minister of Finance with this COP-endorsed document that calls for urgent action to raise tobacco taxes, and being able to ask, that minister to ask her or him why this action has not yet taken place. So it'll be a great tool for advocacy in that sense. It also can help to raise funds for FCTC implementation at the global and the national level. The strategy itself will be a great pitch to funders. It lays out a very clear vision for where the COP would like to be by 2025, and also outlines how the COP is going to get there. So what concrete actions it's going to take to achieve that eventual vision. And, combined with a mandate, for example, for the Secretariat to go out and to use the strategy as a tool to fundraise among development agencies and other funders, it's really easy to imagine that being very successful. And lastly, I think it's important to highlight as well that it will really help to keep COP sessions focused on issues that are of the most importance to the most parties. The idea here would be that COP sessions would become primarily organized around the strategy. So at each COP session, you would review progress towards each of the objectives that are outlined there. There would be a chance to talk about some of the challenges and obstacles, and then decisions would be made about where everybody needs to focus and what needs to be done to accelerate progress towards achieving all of the objectives in the strategy. Next slide, please. COP8 is going to be a really critical opportunity to make progress on this issue. So all parties to the FCTC are going to meet for the 8th session of the Conference of the Parties in October 2018. That's a little typo on the slide there. It's coming up this year. It has not already happened. And at this meeting, the global strategy is going to be presented for adoption. One thing to note is that if it's not adopted at this COP, the next chance for adoption, provided the idea is not thrown out altogether, which I doubt that it will be, the next chance for it to be adopted would not be until COP9 in 2020. So this is a really, really important opportunity that we would like to seize to take a decision that's going to enable some really great progress on global tobacco control. Next slide, please. FCA is going to be working in the lead up to the COP through its members to ensure that the strategy is adopted at COP8. And here's just a couple of ideas on, if you're interested in getting involved in these advocacy efforts, whether you're coming from the World Heart Federation community or you're an FCA member. One really easy thing to do is to talk to your government about COP8 and about the forthcoming global strategy. If you have a chance to meet with the tobacco control folks, you can ask them if they have attended COP or what some of their priorities are going to be. You could also alert them to the fact that the global strategy is going to be discussed at this meeting. And at this point, there's no public copy of the strategy yet, but it will be released along with all of the other official documents for the Conference of the Parties. And I've put the link here on this slide where that document will be accessible when it's released, and the date when I believe that will become available is the 1st or the 2nd of August. The other thing that you can do is, if you're interested in getting involved with these efforts and you're not already, is reach out to the policy team staff, so to Misha or I, for additional resources on how to talk to your government about the global strategy. We do have sets of speaking points and some fact sheets and other background materials. If you're an FCA member, we have a task force, which is a small group of members who coordinate via email to organize advocacy efforts. So if you'd like to join that or to learn anything more about that, feel free to send me an email after this presentation and I can coordinate with you on that. Great. So I guess that brings us just to the end of our presentation. So Misha, I don't know if you would like to take it from here, but if anybody has any questions or comments at this stage in the webinar, please do feel free to unmute yourself and ask them, or to type them in the chat box in the bottom right, and we would be very happy to answer them.
Yeah, thank you, Ryan. That's exactly it. So if any colleague would like to comment on the last two presentations, I believe Kellen.
Yes, Kellen again. I'm extremely excited about the global strategy. Extremely. I think it is pleasant to hear about a global strategy on tobacco control. And I think it is extremely timely for also a continent like Africa, where we are looking at now tobacco control implementation, no longer talking about laws or regulation, because that has been the bulk of tobacco control work on the continent, running around to parliaments and so on to have these laws passed. We have enough laws on the continent and enough regulations. I think we need to strongly take on very, very huge strides in terms of implementation, which is still very, very weak, and also piecemeal in terms of looking at, if you're to assess how well a country is doing, if we take, for instance, the Best Buys, the Empower, you find that there are piecemeals on each of those articles, which doesn't actually translate into impactful tobacco control programming. So as a continent, we are taking on national tobacco control programming, which we think should be like also a low-hanging fruit for the next maybe 5 years for countries to establish programs, fully fledged programs that are properly guided. And I think the global strategy would be, I don't know what is in there, would be a good, also pitch and basis for the national tobacco control programs. My two questions to the architects of this strategy is, how involved have all the continents been? And also, are you going to put in place resources to try and help continents to move down and operationalize this strategy? Critical to note is capacity, resources that are not forthcoming, especially when we look at tobacco control and NCDs in general. So, and also to note that countries have been supported to develop strategic plans for tobacco control, and they are already implementing them. So we need to also know that there's already some work going on, and how will people like embrace this strategy into already what they are doing. But I'm extremely excited. Thank you.
Thank you so much. We're also really excited about the strategy. I think you're right, it is coming at the right time for countries and for the COP, with so much of the, the technical work around the FCTC, so the drafting of the strategy of the treaty itself and the guidelines kind of wrapping up now. It is really time to focus on implementation, and the strategy is going to be a really important thing that's going to help that happen. To answer your first question about how involved all of the continents have been, the working group was regionally representative, so it included 2 parties from each of the WHO regions. So that helped to ensure some representation from all of those different regions in the process of drafting it. Unfortunately, our colleagues from the Eastern Mediterranean region were unable to make the meeting. So I think that there's still a little bit of work that needs to be done in that region by FCA and its members to reach out to governments to make sure that they're aware of this and that they will be ready to support it at the COP. But I know that through the consultation processes that have happened, where the working group invited comments from all parties to the FCTC, there was a fairly good amount of engagement in that process from the different regions. And I know in particular the Afro region, a number of parties there submitted comments. A number came as well from the region of the Americas. So I think that, with the small concern about EMRO, there has been regional representation in developing this. And on your second question about resources, I think that you've really hit on a very important point, that resources are going to be a really key part of the picture in implementing the global strategy. But as I mentioned before, I think that there is reason to believe that the strategy itself will be a great tool to mobilize resources and to help build some of the necessary capacity to implement the strategy and to achieve all of the objectives that it outlined. So, as it outlines a vision for the FCTC, it outlines the way that it's going to be achieved, that vision. And I think that, the Secretariat could use that as a tool to approach funders and kind of get more money that it can use to support parties' efforts. I wonder if there are any members, FCA members, who are on the call who want to add anything about regional or regional involvement, I guess, in the process to develop the strategic framework. I know that we've been asking many of you to reach out to your governments and to speak about it. So if you have anything to add to that, please go ahead.
Ryan, there's still one question in the chat box, actually, from Lutgard, who's asking whether the strategy will give priority to neglected parties that are faring badly in tobacco control.
Thanks, Lucard. It doesn't call out any parties in particular, but I think that in developing the strategy, the working group really had those parties in mind, and really took into consideration the kinds of challenges that these parties face. So I think that that's where the choice of what objectives and what articles of the FCTC to give priority to came from. So I think that the idea, would be that these would be the measures that, if you're in a very resource limited setting, these are the kind of things that you should prioritize in a national plan or in your national efforts.
Well, thank you, Ryan. And then maybe to give a last opportunity for, as Ryan mentioned, colleagues from the regions that would like maybe to add something about their experience in the respective regions, or to ask any questions or add a last comment before we wrap up today's webinar.
T speaking. I'll just like to speak, respond a little bit to Kellen, in addition to what Ryan has mentioned, with respect to regional involvement of parties. Kellen, just for your information, I know you and I have had this conversation some time ago. The Afro region is represented by two parties, by two countries, that's Senegal and Uganda. And you personally know Dr. Sheila's commitment to these type of discussions. So she was actively involved, as well as our colleague from the focal point of Senegal. As Ryan mentioned, there were 2 rounds of consultations actually. The first round of consultation, unfortunately, we didn't really have a lot of input from many parties. We had few inputs or comments from the African region. But for the second consultation, I think more and more African parties, Afro parties were able to contribute. This means we should not, it's true that the consultations are not really open anymore, but I think it's our responsibility to make sure that various parties, each party has ownership of this document, because it's a document that will serve them. It's a document that will help to bridge all the, to develop strategies to respond to all the implementation gaps that they will be complaining about. And most importantly as well, it's a document that could also help to mobilize resources for national tobacco control and for global tobacco control as well. So I'll really be looking forward to working with, we've been doing that already, and I still reiterate, to working together in the lead up to COP to make sure that more and more parties have ownership of this document. That's what I can add for now.
Yeah, thank you very much, T. Is there a last question or last comment that somebody would like to add at this point? If that is not the case, then all that remains for me is to thank everybody very much for your participation. It was an excellent webinar, and your contributions and questions were also very much appreciated. And thank you again for participating, and I hope you all have a very good 31st of May, World No Tobacco Day, and have a good day. Thank you.
Thank you.